My name is Mark Wheeler. Welcome to Module 4, Track 1. This is a vision of healthcare research in 2020. Our first speaker is Dale Cooke. Dale is the owner and president of PhillyCooke Consulting that provides advice and training to companies about developing compliant promotional materials for FDA-regulated products. Dale works with pharma companies, technology platforms, and advertising agencies to ensure that people can get the information they need on the digital platforms that they prefer to improve their health. Dale?
Thank you, Mark. Sure. You don't have to feel guilty about applauding for the FDA Fellow. You know, that's okay. I heard regulations and FDA regulatory concerns coming up multiple times throughout the day, and I thought, fantastic. This is going to be perfect preparation for when I get up there and tell them they can't do anything that they wanted to. But actually, that's not what I'm going to do, although I am going to be talking, of course, about the topic that's sort of always the elephant in the room when it comes to any sort of communications. And no kidding aside, you know, we are working in a regulated industry and those are concerns. And of course, if there's anything that people enjoy less than FDA regulatory concerns, it's advertising itself, which is certainly not something people like or enjoy experiencing at all. And if there's any form of advertising that is particularly despised, it would have to be prescription drug advertising. This, by the way, is a still from a John Oliver 15-minute diatribe about the pharmaceutical industry. If you haven't seen it, seriously, go take a look at it on YouTube this afternoon, this evening. John Oliver has become an incredibly powerful voice. I think he was one of the main reasons that net neutrality came down the way it did. And he has the pharmaceutical industry in his sights. So you, at the very least, need to know what he's saying about us and about our communications. And so this was a parody. Of course, you know, these parodies are out there all over the place, right? Saturday Night Live and YouTube have turned parodies of prescription drug advertising into something of a cottage industry. And lurking in the background behind this notion of like, why this advertising? What's wrong about prescription drug advertising? What's making that so much worse than any other type of advertising? Lurking in the background is this sort of concern that like somehow or other we have these magical, mystical powers to cause a tremendous overprescription of medication. And interestingly, there was a study conducted right here in Philadelphia. More than 5,000 different oncology patient encounters were reviewed, and in fact, 0.14% of the time did patients request unnecessary medication. So this idea that patients are seeing the ads on TV and immediately going in and asking their physician for all of this treatment that they just don't need, that's unwarranted, actually just isn't true, right? The stats bear it out that that's not what's going on, and that's not what's actually driving over-medication of patients, right? But nonetheless, there is this concern, and the good news about advertising in general is that it's going away, right? I watch most of my TV on Netflix, right? When I'm not watching on Netflix, then I'm using my DVR, and of course, what am I doing? I'm skipping right through all of those ads, right? And when I get a magazine, what's the first thing I do? I shake it upside down to make sure all of the inserts fall out, and I've got at least 14 different types of pop-up blockers on all of the many devices that I have. So it's getting more and more difficult for traditional advertising to make its way into the consumer's hands. And that's good news for consumers who don't like advertising, but the bad news about that is that advertising has information. It has information about products and services that people actually need and that would improve their lives and improve their health. And advertising isn't just about finding the people who already want your products and convincing them about it. It's also about telling them about products that they haven't even conceived of, that they haven't even thought about wanting, right? The famous quote from Henry Ford about what would have happened if he had asked his customers what he should do. They would have told him to get a faster horse, right? But once you then put out the idea that there are these new products, there are these new services that can actually meet people's needs that they didn't even realize that they had, right? So that's one of the ways in which advertising helps people out, and nowhere is that more true than in healthcare. Right? If you're fortunate enough to neither you nor a loved one actually have a condition that requires the treatment of a physician, congratulations, count your blessings. For the vast majority of people, though, we at some point or other will wind up having that experience, either for ourselves or for a loved one, of trying to navigate the American healthcare system. And in general, that experience is not a really positive one for most people once they find themselves there. Once you find yourself in the American healthcare system and you finally get to see your physician, you walk in the room and the clock starts ticking. And you know that the patients are being scheduled in 15-minute increments, right? You know that up front. A recent study was conducted that showed that on average, patients were only able to talk to their physician for about 12 seconds before being interrupted, either by the physician, by somebody walking in, by a beeper going off, by something or other. So if you have a condition, or if your child or your parent or your sibling has a condition, and you're in that room with that physician, you need to come prepared. You need to come prepared to have an informed discussion because your time constraints are very, very real. And when you want to get that information out, and let's say, for the sake of argument, that there's a product out there. Let's say it's been reviewed and approved by the FDA, and that it actually would treat the condition that you're in that room to talk to that physician about. Well, who has the most vested interest in ensuring that that conversation comes up, goes well, that you walk into the room confident, that you walk out of the room feeling like your concerns have been heard? Well, obviously, that would be your friendly neighborhood pharmaceutical company, right? The manufacturers of those FDA-reviewed and approved products. But as we were talking about earlier, it's been more and more difficult to get information out to consumers via the traditional advertising channels because those channels are becoming less and less effective as people find ways to simply avoid them. That's happening in part while at the same time FDA is itself taking enforcement action to make it more difficult for pharmaceutical companies to make use of new and emerging digital channels, right? Back in 2009, the FDA took some massive enforcement activity that in essence said you cannot make use of some of the most popular space-constrained and limited channels that people were using, and people were shocked by this when it happened. And that was a deep, deep concern. Now, traditional advertising is dying. People aren't watching their TV commercials because they're DVRing through them. But I don't want you to think for a second that it's the case that people are stopping their consumption of media. Nothing could be farther from the truth. This year, we Americans are going to be consuming, on average, about 15 and a half, almost 16 hours of media per day. And if you're wondering, my God, when am I going to have time to sleep? Don't worry. The researchers pointed out that we're so good at multitasking because we can watch TV while we're listening to the radio, surfing the internet, and text messaging people, that actually we can consume more than 24 hours of media in any given day, which is just fantastic news, right? Now, when we're doing so, though, we're doing it on all of these other channels, right? Via the text messages, via our devices, etc. And in the past few months, the tide has turned. Pharmaceutical companies have received some fantastic news from the FDA via a set of guidances that came out last year. There were multiple guidances on the topic of social media and the internet and what you could do. And the FDA has really loosened up the reins significantly on companies. And critics of the FDA, and I put myself in that boat as well, really focused on all of the drawbacks and the flaws that were contained in those guidances. And I want to make it clear that the guidances do have significant drawbacks and flaws. They're not perfect, they're not flawless. But today what I want to do instead is to focus on the fact that we got all of these guidances, and my goodness, look at what we can do moving forward that we couldn't do previously. And to give you some sense for how widely things have changed, this guidance came out back in 2009, that landmark year for the pharmaceutical industry and for people who make prescription products. It was a 27-page guidance that discussed prescription product risk information, how to present that information. And in 27 pages in the year 2009, the FDA thought that the internet and websites merited 3 mentions. 2 of those mentions were in footnotes. One of those footnotes was in the section on print. So obviously, when I say that last year we got a series of guidances, it was 40 total pages from the FDA dedicated exclusively to the issue of the use of the internet, social media, space-constrained locations for the communication of prescription drug information. That is a major step forward from the agency and for industry. And as I have alluded to earlier, the FDA has made some significant accommodations for industry. First off, the FDA, via its positioning on the filing of promotional materials, has really opened up and enabled real-time communications in a fashion that previously was simply impossible to engage in. The FDA has also taken the common sense position of explicitly acknowledging that user-generated content that's generated independent of a pharmaceutical company is not the pharmaceutical company's responsibility. Now, that's a common sense position, but I got to tell you that for the past 4 years, I've been arguing with people at pharmaceutical companies trying to convince them that that was true, so that the FDA finally put that common sense position down in writing and endorsed it was a major step forward for the industry. The FDA also granted the idea that abbreviated, shortened versions of the indication and risk statements could suffice. That's one of the most commonly cited infractions by the FDA, is a failure to fully communicate the approved indication and all of the risk information. The FDA also endorsed the idea that the use of links could be handy to both meet some of the promotional requirements as well as to grant the full risk information. So all of these accommodations, significant moves by the FDA to really enable the pharmaceutical industry, and not just pharmaceutical products, biologics, medical devices as well, to really engage in these communications, as well as endorsing the idea that that going out and correcting misinformation is something that the FDA wants you to do and wants to enable a process where you can do it. So all of these things are amazing things. And what are we seeing as a result? Well, let's take a look at this example. So this is Novartis, which manufactures a product called Gilenya. Gilenya is on Twitter. It's one of 2 brands that's on Twitter. And this exchange that you're looking at up here is Novartis engaging directly in a real-time conversation with a person who has MS and is using their product. Now, in many other industries, you would look at this type of exchange and you would say, yeah, so? Well, in our industry, 16 months ago, you couldn't do this. Right? You would have been violating FDA's regulations. Now we're seeing this happen. I want to be clear that I'm not saying to you that, oh, everything's going to be bright and rosy and all of our communications now are going to be so easy, and oh, tomorrow you're going to see a pharmaceutical company that's using social media as effectively as Delta Airlines is using social media. That's not going to happen. For one thing, it's going to take the industry a while to catch up to what the FDA has enabled and permitted them to do. And of course, for another reason, Delta Airlines takes you to that vacation. It takes you to that business meeting. It gets you there, right? Their old slogan from years and years ago. It gets you to where you're going. We don't. What we do is make sure that you're alive and healthy for that vacation, for that trip. So the things that we're going to do on social media are going to be very different. They're going to be unique to our particular needs and our constituents' needs, but the possibilities really are endless. Thank you.
We do have about 4 or 5 minutes for questions, if anyone would like to ask something.
I'll get it. Okay. Here you go.
So you talked about how it's going to take a while for pharma to catch up in social media. What do you see as the biggest missed opportunity now that could be done now in social media?
Yeah, that's a great question. In a word, it's YouTube. There was a former client of mine. We spent a year and a half getting a YouTube channel up and running. Going into that project, why did we think YouTube was right for that person? Well, because if you looked at that product and you just went on YouTube and did a quick search for the brand name, the #1 video that popped up that had more than 20,000 views was for somebody demonstrating how to use the product. And they were demonstrating it wrong. So there was actually a public health risk because that was the most popular view for their product. And you know, the thing about YouTube is that's where we all go to learn how to do things nowadays, right? When you want to figure out how to put together that IKEA thing that you can't understand the instructions, what do? You go to YouTube, right? For any type of information, when I was learning statistics, I was having trouble with my software. Where did I go after getting frustrated by the professor not helping me? I went to YouTube to figure out how to use the software. In 3 minutes, I figured it out, right? But so many pharmaceutical companies currently have zero presence on YouTube. And if you don't have any content there, well, then there's no opportunity for somebody to see the other information. We know people love video. We know they go online to YouTube. Why isn't everybody there? Additional questions? Yeah.
Is there different guidance, FDA guidance on fair balance for a YouTube video than there would be on DTC, on traditional television?
So that's a great question, right? How do you understand a video on YouTube? What is it? Is it advertising? Is it promotional labeling? Because those two different categories of communication have radically different requirements associated with them. And the FDA has never formally said one way or the other. I think actually that's a good thing because I think some videos on YouTube are promotional labeling, and I think some videos on YouTube are advertising. If it's a 1 hour, video on how to use the product, more analogous to say an infomercial that you might see on a Saturday afternoon, that's promotional labeling. If it's a 15-second, skip this ad at the beginning, that's advertising, right? That's my position. FDA has not formally endorsed that view. They've actually, in podium comments at various conferences, have said various things about that, some of which they've contradicted at later conferences and later dates.
Thanks, Dale. Very